I want to thank you for the opportunity to present today and the invitation. I'm going to try to paint an overall picture of the glaucoma situation in the world, how many people are suffering from it, how many people are getting treatments, what type of treatments, and how this changes depending on where you are in the world. So there are 125 million people globally with glaucoma, and I'm including ocular hypertension in there. To get to that total in 2015, it's supposed to grow to 142 million by 2020. So it's growing at a rate of about 2.4%. Primary open-angle glaucoma is the most common type of glaucoma, 42.2%. Ocular hypertension, 35.9%. ACG is one of the fastest growing. It's growing at 2.8% on a compounded basis. You can see these numbers varying on what the growth rate is for each area. Now, if you look at that on a regional basis, you find the fastest growth in China and Latin America. This is mainly being driven by demographics. In those particular parts of the world, you have a rapidly aging population and plus good population growth. In places like Japan, Europe, and the U.S., the rate of growth is in the 1 to 2% area. It's growing much slower in those areas. And again, it's because you have slower population growth and because of the ethnic mix in those markets. Now, the big difference here is between the diagnosed and the number of people that actually have glaucoma. So if you remember, we have 125 million people with glaucoma, but only 36 million are diagnosed with glaucoma. So there's a lot of people that either don't have access to care, or because they don't, there's not necessarily any pain associated with early stage glaucoma, they don't really realize they have a problem until they have vision loss. And so only 25% of the people are being treated. Now, we expect that to change. We expect it to grow to 32% by 2015. And so we see a growth in the number of people that are diagnosed and in the treatment paradigm, and that's because of improved access to care and just general growth and awareness. Now you can see that if you look at the fastest growing, primary ACG is the fastest growing, and that's mainly driven by the growth in the Southeast Asian population, which have a very high rate of angle closure glaucoma. Now if you look at it by region, you can see that the fast growing regions are China, Latin America, and then also India is a fast-growing area, but not as fast as the other two, mainly because you have a younger population mix. The slowest growth is in Japan, Europe, and USA, for obvious reasons, slow population growth. Now, if you look at it by number of medications, and this comes from a survey, I'm going to talk about this more throughout the talk, but we surveyed ophthalmologists in the U.S. and Europe and asked them about what percentage of patients are on no meds, 1 med, 2 med, 3 meds, and 4 meds. And so you see that about 10 to 16% are really not on any medications, and about 11 to 21% are on 3 or 4 medications. And that varies somewhat by region of the world between Europe and the U.S. But the average for both markets is 1.5 meds per patient. Now, if you look at what this growth is going to mean in terms of medications, we see this growing from 134 million units. A unit's described as a 30-day treatment of meds to 169 million, compounded growth rate of 4.8%. This is somewhat slower than the growth in patients that are diagnosed, and we see this because of more surgery, newer surgery, mainly MIGS and other diagnostic treatments that will lower the number of medications per patient, or the number of patients on meds, and also improved medications, depot medications, things that will release over time, so that patients may only need one treatment every few months that would slowly dispense over that period. Now, when you look at the overall treatments, and just to kind of put this in perspective, again, you got 125 million glaucoma OHT patients globally. Only 36 million of them are getting treatment. We have 12.6 million that are full-time on drugs. And the reason that that's so much lower than 36 million is, first of all, you have some glaucoma patients that are not on drugs currently, and then you have a high rate of non-compliance, and we express these as full-time equivalents. So If you have one patient that takes their meds half the time and another patient takes it half the time together, that's 1 FTE. There are 2.1 million laser procedures. Those are kind of a mix between SLT and ALT. Depending on what part of the world you're in, it may be more common to get SLT, and another one more common to get ALT, but around the world, both of those procedures are used. 322,000 trabeculoplasty filtering procedures, 98,000 tube shunts are implanted worldwide, and right now 88,000 MIGs. Those are mainly right now the iStent and the Zen. We see this as a rapidly growing area. Most of the iStents are in the U.S. Most of the Zens are in Europe right now because that's where they have approval and reimbursement. And then there's 125,000 of all the other procedures combined. Now, if you just look at the interventional surgery and divide that out, filtering is the largest at 29.4, shunts 22.3, the iStent at 30.5, and the Express at 9, and all others 8.9. And the other would include ECB, trabectome, canaloplasty, and others. Going forward, we see a steady growth in the population going forward, 2.3% compounded annually. We see a faster growth in the number of diagnosed patients, 5.3. Medications we see growing 4.8. But the part of the problem is there's only a 2% global growth in the number of ophthalmologists. So this creates a disconnect with expanding treatment and number of diagnosed patients and having the people to do that. So we need more effective and more efficient glaucoma care models that are able to take care of these patients. We see lots of opportunities here in new technology, mainly better diagnostic tests, better medications, particularly in drug delivery where we see drug depots providing long-term release of medications. It means fewer drugs taken, better compliance, and relieve some of the burden of care. We see different mechanisms of actions in glaucoma care coming down the line, and of course combo medications continue to come along that reduce patients from 2 meds to 1 med a day, or 3 to 2, or whatever. And we see new procedures that reduce the number of patients on medications. We see both improvements in the current procedure, MIGs, and new laser or other treatments out there that should reduce that. We have a lot of sources for all this data, including Census Bureau data. We use a lot of clinical research. One of the most important is a doctor survey. I would extend an invitation for anybody to participate in that survey. The website is listed here. If you participate, you get the analysis of all the survey results, and the copies of the slides I presented today and the material that support this is also available on the website. Thanks for the opportunity to speak to you today.